I am Shannon Weber with Hive, a hub of positive reproductive and sexual health, and I'm here in Los Angeles. It's October 16th, 2015. Getting ready to talk to the amazing
Ken Almanza, PrEP navigator for APLA Health and Wellness.
Great. So we're going to talk about this PrEP navigator role, which is kind of a new thing that's come out of the last year, and it looks like there's going to be good news, more navigators coming in different areas. So we're going to learn more about the PrEP navigator role. But first, just to help ground us, tell me a little bit about APLA Health and Wellness. So tell me about this center.
Sure. So APLA Health and Wellness is a federally qualified health center. So not only are we able to offer PrEP services and management and care, we're able to offer general services. So we have our behavioral health, we have STD testing and treatment, we have enrollment for like Covered California, for Medi-Cal. So we have all the wraparound services that any fairly qualified health center would have. The only difference is that we actually have a full PrEP navigator program, which I get to be part of.
And so PrEP navigators can show up in different places, and it's going to have different flavors depending on where people are and what services they offer. But we're talking about some of these roles that a PrEP navigator does or can do depending on how task shifting happens with the nurses and MAs. So what are the important essential roles that you do as a PrEP navigator?
So as a PrEP navigator here at APLA Health and Wellness, I would say my main kind of like the three pillars, if you will, would be really talking about, first off, HIV risk. So assessing HIV risk, making sure the patient understands that what the risk for HIV might be. The second would be insurance, so access. So what does their income look like? What does their current resources look like? Are they unemployed? Do they have a commercial health plan? Do they understand what insurance means? So I break it down for them. And then the third would be just explaining what PrEP is and how the services would be delivered here. So depending on how that client, where they're at, I just kind of meet them where they're at and explain it on their terms. So it's something that's reasonable and something that's easy. I want it to be seamless. I don't want them to feel overwhelmed. So I try to do that.
And so those three things might come up in different order depending on how or why someone came to you and what their first concern is. But they're the three components that you need to kind of cover in this visit to figure out with someone.
So behind the scenes, I mean, we're doing multiple things, but to the patient, I want it to appear as just one calm, seamless setting, because accessing PrEP is relatively new. And people don't really understand everything that goes along with it. So I have to really break it down in an easy way that they'll understand. So again, we're located in Baldwin Hills. So there's a lot of people of color who are here. We have a lot of people who are either unemployed or lower income. And then we also have people who, have PPO plans, who have commercial plans. So, and people who are educated about it and people who are just ready to go. So it all depends on how, just to cover, I want to cover everything and make sure they're on the same page and that they're going to have a good experience.
So logistically, tell me how people get referred to you.
So there's multiple ways someone can come into our clinic. The first one could just be word of mouth. APLA Health and Wellness has been very, they've been doing a lot of collateral. We've been doing a lot of advertisement for the program. We have a lot of people who internally have helped us grow and really push this program along. So that's a wonderful resource. We have people who come in for STD testing and treatment. So if they maybe test positive for chlamydia or gonorrhea, the doctor or the nurse might walk them to me. When they're in that moment that, stages of change, like maybe they need to hear it at this moment. It's a really good kind of...
And so that's an internal referral. So that can happen. People can literally be here getting tested for STD or HIV and then get referred directly to you.
Just walk in. We do have, again, walk-ins that just kind of see the sign outside. This is PrEP services. Since PrEP is relatively new, maybe they just want to have some information about it. And maybe it's not even for them. Maybe it's for a friend. Maybe it's for someone they think is high risk. I mean, I have that too. People are in the waiting room and we have a lot of great collateral. That just kind of pinpoints like, what PrEP is, it might be right for you. So it's great to be able to just be that first point of contact.
And you also mentioned that in your electronic medical record here at the clinic, someone can get referred to you. So it's not just the warm handoff walkover, but there's also a way electronically of making the referral.
Correct. So basically, as the PrEP navigator, I have access to our ECW program, which allows me to get electronic referrals from either the STD HIV counselors, from the medical director, from our nurse practitioner, and I'm able to just follow up on that. Because sometimes the patient doesn't have time to talk about it.
Right.
So I'll call them and I'll schedule time for them to come in, or we'll just do it over the phone.
Yeah, or you might see things in there that will help you understand the interview you had with them better.
Totally.
And then I want to ask you also about when someone may be coming for HIV or STD testing or STI testing, and then they don't have insurance that is here, what is the navigator's role then for PrEP? So
the PrEP, as a PrEP navigator here at APLA Health and Wellness, I'm actually a certified enrollment counselor through Cover California as well.
Oh,
so
awesome.
I'm actually able to walk them through that entire process. So maybe after we've kind of touched base about HIV risk and what PrEP is, I'll get into the details about their income. Sometimes they have their information on hand where we can get the sign up started, and sometimes I just kind of have to tell them, this is what I'll need. I'll need, you know, your proof of address, your proof of income, and you're going to come back and I'm going to do it for you. Like, you're not going to get passed off to someone else.
Right.
I'm going to sign you up, and I will monitor your application, and I'll schedule your appointment for you.
Yep.
So it's all done, you know, on my end.
Together for them, which is so helpful. And then for folks who have coverage elsewhere, as part of the navigator, your role is to help them get connected with the PrEP services back at, say, it's Kaiser or at their PPO or wherever else it is.
Yeah, definitely. I think I myself personally have been so entrenched in the PrEP community, so I do have a lot of contacts. I mean, like yourself, you know, I reached out to you as well.
Yeah.
So it's great to be able to just call somebody up or email someone that I know already at that facility and be like, hey, I have this patient, you know, and they always, they're such open arms, you know, they're like, yeah, send them over, I'll help them out, and they follow up and let me know they've been linked. So no matter where the patient's coming, I want to make sure they get access to something because they're requesting it.
Yeah.
And if they're requesting it, then I have no, you know, I praise that person because they want to do something about their health.
Right.
And I think most people should praise people.
Beautiful stuff. Tell me how many people you think you've talked to. You started in this role in...
I started in April of this year, so we're in October. So I would say around 300 plus people.
You were saying probably 80 people a month.
Yeah, on average. Yeah, on average.
So there's a huge interest, and this is a huge need.
Huge interest. I mean, I've only seen it grow since I've started, you know, and I've seen people as we have a lot more people who are visible who are on PrEP. We have so many opinion pieces online and articles and so many wonderful advocates that I think that just kind of gets those wheels turning and everyone's just kind of hopping on board. And I think you're seeing all these wonderful people pop up who are being advocates, and there's different messages for different communities. And I think everyone's doing a great job.
Yeah, it's good. It's a great network that's forming. What do you think? We were talking about how this is a new role, and there's going to be more navigators in the future because of funding that's come down for different places. What are some pearls of wisdom that you've learned? Like, here you are, not only frontline worker, but you know, one of the first generation PrEP navigators. Tell me a pearl of wisdom.
Be humorous. Be willing to be open with your clients. Be willing to just go there. I mean, we're dealing with such a unique community, and we have to understand that we have sex a certain way. We go to certain events like Folsom, we go to bathhouses. You know, there's people who are in the adult film business. We're in Los Angeles. I have a lot of adult film stars, you know. So it's kind of like one of those things where you have to understand what you're dealing with. You're talking about sex. So you don't need to be uptight. You know, just like loosen up, talk about it how the patient talks about it with you, you know. Be real. You have to be real. You have to understand that the patient needs to be educated about HIV, about STDs, about things, and you need to meet them where they're at. You definitely meet them where they're at, and leave your own bias, leave your own judgment outside. Like, you have to definitely be open to everything you hear, every story you come across, and understand that this person might be at risk, and how are you going to help them?
I really hear from you and from conversations we had before the video too about the power of the relationship that you have in this navigator role, and maybe that's another thing that we want to add to the pillars, right? And like, it's not just the mechanics of how you get insurance and how you understand risk. So there's something about the power of the relationship that you have with folks that's helping with the navigation process.
Definitely, I think you know, I have to point out the fact that our PrEP program is run mostly by people of color. You know, our doctor is Black, our nurse practitioner is Latina. I'm, you know, Mexican American. So when you look like the clients and you can joke like the clients and you can jive with the client, it changes the entire dynamic.
So beautiful.
That trust and that rapport is built, and you're never gonna lose it. I mean, my patients come in, they're like, "Hey, Ken, what's up? What's going on? What are you eating for breakfast?" Like, you know, they come in and we've built that already, and it makes me feel good because they feel comfortable coming to a medical facility. And you can't say that for a lot of medical facilities. You feel so
So
stiff
true.
and sterile, and they come in here, and they don't need an appointment to come. Like, if they have a question, just walk in.
So
like,
great.
if you want to come and talk to me.
Yeah, where can you do that?
Where can you do that?
That's
You
so
know,
good.
and I'm a gay man. I'm open PrEP user, so for me to be able to, you know, mold those two, like fold them together, it's awesome to be able to just be like, I'm helping people out, you know, and I'm not judging them because I essentially am a client too.
Yeah.
You know, I'm in the same boat they're in. I'm a gay man. I'm in the community, and it's all, there's no judgment here. You know, let's just help each other out.
Thanks for all you do. This is so
Thank you.
inspiring. You're
Thank
such a
you.
pioneer.
Thank you for coming. Thanks for watching.